session. Just to enlighten you a little bit about what we're doing and how we're moving forward. First of all, I'm Pastor Smith. For those of you who don't know me, I pastor in the Creations International Church, the greatest church in this hemisphere. Praise God. I gave what Pastor says it. And so, wanted to talk to you a little bit before we get into the Information Center so much about what we're doing, why you're here. Also, we have started a new ministry, and we're calling it the NEMA Information Resource Center. And so what we're going to be doing this session is part of that. And so what we want to do is keep the community informed. And so we want to have community events here, community information center, information events, things that will keep keep people engaged in the things that are going on in our community. Keep people engaged in social justice issues. Keep people engaged in things that are for health and for health and benefits and welfare, the quality of life. All those things, those are the things that we want to put on. It's not an event. It will be, we will have representatives of different agencies that will meet in the lower level of the church to provide help, aid, and assistance in whatever areas that they work with. We're currently working with labor. So we're hoping to have some of the labor unions coming down and explaining the things that they do. We're working hand in hand with the NAACP on the end of the event as the president back there chilling. And we're working on hello. We're working on a health and welfare, especially working with the issues that are pertaining to minorities and with health and welfare issues. And so we are trying to work diligently at keeping the community informed. And so we're excited about that, excited about where we're going to go with this. And so this is the first of many sessions, and I thank you all for all coming. I got a big Zion group here, and so glad that Zion has always been big supporters of the creations as well as other ministries. Recognize Pastor Dial from Bethel A&E. Thank you for coming and being a part of this. Also, and I did mention briefly Kevin Sanders, who is the president of the NAACP here in our Iowa City chapter. So we're so glad that he is here also. And like I said earlier, you will see some of our members fly in and out because we have another event. Unfortunately, we have another event that's going on at the same time, and so they will be in and out also. So I want to start off by asking the question, why are you here? Why are you here? So anybody, why did you come? What brought you here today, other than my flyer telling you that the event was today? What brought you here? Anybody?
See some see additional faces of people who share the same concerns.
Okay, okay. All right. Anyone else? Yes, sir.
I'm really concerned at the cynical way in which Congress has constructed a sort of cliff for Medicaid eligibility with work requirements and onerous reporting requirements that don't go at all to the question of somebody's need, but rather that seems cynically designed to knock people off. And I'm very interested in thinking about ways in which, and I think what you just described is great in terms of information to help people navigate this, and obviously over time resist it as a way to dole out basic human rights.
Awesome, yeah. I think, you know, one of the things that I think is oh, I'm so sorry. I don't know what I'm supposed to be, there's an online presence, and I wasn't passing my. Not now, but, yeah. I am so, and that was one of the reasons why we wanted to have this, because there are a lot of things that are going on, a lot of moving parts to this, to Medicaid, Medicare things that are going on right now. And if we, and some things some things we don't have control over, but but a lot of things we can be informed about. And so we have to be able to prepare our congregations, we got to be able to prepare our community, we have to be able to prepare ourselves, you know, so that, and know where our help and our resources are. So that's, you know, that's one of the key reasons why we're here. And one of the things that I thought about, you know, I was at one time when I first thought about doing this, I was thinking that, oh, maybe I should just target people, X amount of people. But then as I thought more about this, it needs to be something that is communicated to everybody, because everybody has somebody that these things can affect. If you have a loved one that's a senior, if you have somebody that has disabilities, if you have somebody that is a young person that has disabilities, if you're 64, getting ready to turn 65, if you're working and you currently are on Medicare and Medicaid, this affects everybody. And so we need to be able to be conscious, be aware of those things. Anyone else? Why are you here? Yes.
I think there's so much fear out there, and like you say, it affects everyone, because everybody has somebody that they know that is in a situation where they need to access resources. And so we hear all this stuff in the news, and I get, you know, freaked out and afraid, et cetera, and then it feeds upon that fear is not helpful. So I think any information or the facts that we can get is helpful.
That's
For
right.
both like me, the family, but also neighbors that I know that are concerned. So, yeah, getting information.
Yeah, it's important. Huge. Is there anyone else that had a comment? Did you have a comment? Oh, okay. Yes, sir.
We have a finite amount of time and energy. And
we're at will to choose how we spend that time and that energy. And I want to make sure that time and energy is spent pursuing things that actually make a difference in the lives of people. And I kind of trade my energy and excitement about what's going on politically, because that can just sap me down to nothing, for trying to go hands-on and doing something about it with that time and that energy. I want to be, and I think I always want to be effective with what we have. And I think this information will help us understand how to be more effective. Great. Does anyone else want to say why you're here? Why did you come today? Anybody else?
I came today in reference to Medicare because I turned 65 years old and I enrolled, just like the government makes you enroll in Part A. And then with Part A, I just needed more information because I enrolled in Part B as well, and for prescription coverage. So I just needed more information because although I turned 65, I have not retired from working. And I just needed clarification whether to drop Part B and enroll with my health insurance coverage at my job. Yeah. I also have supplemental plans as well. So I'm weighing the options about the coverage as well as the cost of these plans that I have. So that's why I'm here.
Okay. Anyone?
I'm here in part because I think it's so important to build community and coalitions to move those issues that need to be addressed forward. And every chance I get to be with people, like-minded, people who are on the fence, even people that don't agree with me. You know, all of that conversation is critical for building community.
Awesome.
Good evening, everyone. I'm actually here to find out what new names are being passed off as Medicare Advantage so that I might make a wise decision about my medical coverage. And yes, it's true that all of us cannot afford to pay the dollars that is needed to cover our lives medically, but our money should be spent wisely.
Awesome. Anybody else? Wonderful. Well, it sounds like everybody has some legitimate concerns. And I'm hoping that we get some answers, and some good direction that will come out of this conversation today. So this brings us to our first speaker, who is Jennifer Sherer. And many of y'all probably know her because she is located right here in Iowa City. And she is the Deputy Director of the Economic Analysis and Research Network, EARN, and the Director of the EARN's Worker Power Project, which supports research, organizing partnerships to advance racial, gender, and economic justice through state and local, through the state and local policies that expand workers' ability to unionize. Prior to EPI in 2021, Jennifer served as the director of the University of Iowa Labor Center and has been active in the labor movement for over 25 years. So please join me in welcoming Jennifer.
Thanks, Pastor Smith. It's great to be here, and yes, to see several familiar faces and some new ones to me as well. So my job really is to just give a brief introduction and some context leading into the speaker who really is the main attraction tonight, Andrew from Concord, Iowa, who's going to delve into analysis of how the many changes to various programs that are happening rapidly this year are potentially going to affect Iowa. So Economic Policy Institute is where I work now, although as Tony said, I've lived in Iowa City for many years and know many of you through various kinds of work. I wanted to say that first because anything I mentioned plus a lot more is on, EPI is a nonprofit, nonpartisan national think tank that for almost 40 years now has focused on analyzing and supporting policies that improve the lives of low and middle income workers. That's our mission. We also support a network of state organizations across the country, including Concord, Iowa, who you're going to hear from tonight. And I wanted to start by mentioning where I work because, like I said, the website, if you are interested in lots and lots of analysis of how our economy is, or in many cases is not quite working right now for working people, EPI.org is where all our stuff is. And the first thing I want to note is that one of the things my organization currently has, where I currently work, has focused on for decades now is trying to pinpoint the policy choices and policy decisions that have created so much inequality in our economy. So these are just a little smattering of some of the things that we routinely measure, lots of different ways to measure that, but for example, the way in which the gap between what folks at the top of income brackets are making versus the vast majority of people in our economy. The reality that our economy is not creating jobs that create a livable wage. So people may be working very hard, or in some cases working multiple jobs, and still not being able to feed their families or cover their healthcare costs. And this is probably one of our most well-known charts, which looks just like two lines on a graph, but really what this is representing is the bottom line is average workers' wages, going back to the middle of the 20th century up to the present. The top line is what economists call productivity in the economy. So when productivity goes up, it means that profits are also going up. And you see the way in which those two lines are very intertwined through the middle part of the 20th century. And then this gap starts opening. And the gap keeps getting wider and wider, and it's gotten as wide as it's ever been since we started measuring it anyway, in the present. That gap really represents money that is not ending up in workers' pockets, in families' pockets. It's going elsewhere in the economy. So this is just to set the stage and transition into the topic for tonight, which is really going to be walking through a lot of, frankly, complicated and sometimes confusing different programs And one of the reasons we have such a complicated patchwork of health and safety net programs in our country is that, to start off with, I think we have to step back and put into context that we are still, in the US, the only industrial democracy in the world that does not have a universal guarantee of health coverage for everybody. So that's our starting point. We are, of course, going to mostly talk tonight about where we, with some of these very specific programs. I put these all on one slide because I constantly get confused myself. And we always sort of have to remind ourselves, what are we talking about then? We are going to talk quite a bit about Medicaid. Medicaid is the program that we have in place in the US to fill, all these programs don't quite ever totally fill this gap that we've got in our country, but this is one of the programs that's designed to fill part of the gap specifically for low-income adults and children. Lots of different sub-programs that states give different names, and again, we'll talk more about that. So if you've heard of Hawkeye, for example, in Iowa, that's a Medicaid program that covers children of low-income families. Medicare, a couple of people have talked about turning 65, which is the magic age in our country where we do have universal health care, but you gotta make it to 65 before you get that. So that's health insurance for those 65 plus. Medicare is also very important for covering people with disabilities. And then the Affordable Care Act is gonna come up tonight a little bit because that is very wrapped up in the policy debate going on right now in Congress. Also known as Obamacare, folks may remember, we had a big, it was a health insurance reform. So again, it didn't quite get us to universal health care, but it was a reform that was designed to take away some of the barriers that many people were facing to getting private health coverage and to try to lower the cost of buying your own health insurance for folks with middle and low incomes. And last but definitely not least, we will talk tonight a little bit about SNAP, the Supplemental Nutrition Assistance Program, which is food assistance, really essential food assistance for the lowest income families in our country. All right, and the reason we are talking about all these programs tonight is that all of them in various ways were and are being potentially affected by changes in the very massive budget bill passed this summer in Congress. Many of us have lots of different names for that budget bill now, but officially it was known as the One Big Beautiful Bill Act. I have to say the first time I saw a picture of Mary Ann Milner-Meeks carrying a binder with that name on it, I thought it was a joke. I thought it was, but this can't be serious with the name of the bill, but that is the name of the bill. Very big budget bill, did a lot of different things, and I'm just sharing kind of the shorthand. There's a lot of analysis on our EPI.org website about the elements of that bill that when you boil it down, it really represents a massive, massive transfer upwards of wealth. And one of the many policy changes in that bill that contributed the most to that trend, or that will, I want to say the other thing that is true about many of the things we're going to talk about tonight is that not all these changes have taken effect yet. And so one of the reasons I'm here, and I think a lot of us are here, is that any of the changes we talk about tonight that haven't taken effect yet could still be stopped, could still be changed. And I think we have to keep that in mind. Anne's going to talk about some of the timelines that are further out. But one of the things the bill proposes is very big cuts to Medicaid benefits. As we just mentioned, Medicaid is the way that many low-income families and children access health insurance coverage. This is a chart one of our economists put together analyzing the equivalent of what a Medicaid cut will mean to a low-income family because of the cost, potentially, of trying to access health care compared to the kind of tax cut that family might be getting, which is less than 1%. And the reality that the hit that low-income families will take in their overall household income is negative, and in the neighborhood of 7 to 8% decrease in already lowest income households' total income. Whereas if you go all the way over here to the top 1% in the country, their benefit from the tax cuts, which are weighted toward the wealthiest, highest income folks, is a net benefit. And of course, they don't suffer at all from a cut in Medicaid because they weren't eligible for it to begin with. So this is, again, the bad news portion of our discussion tonight. These cuts that are proposed and have been enacted, but again, not all of them have taken effect yet, to healthcare access and food assistance are also being layered on top of some very serious economic threats that were already existing or are now looming because of policy changes. And that includes many of the federal funds that have been cut already by the new administration. So I know we're going to talk about SNAP and nutrition assistance. Lots of great programs from the federal government that were supporting food banks or were supporting farm-to-school food programs have already been cut this year. So we have all these things layered on top of each other, which is very concerning. And same thing in the labor market, which is really where a lot of our EPI economists focus their analysis. Job cuts because of federal firings, which affect the whole country. We have over 20,000 federal employees in Iowa, for example. They're not getting paid right now, most of them. And the withdrawal of massive amounts of funding that was slated or that had been allocated for a lot of projects that people were starting to work on, creating jobs. Those jobs are going away. So a long list of economic changes this year that are all adding up to a very, big concern among a lot of economists that we could also be on the verge of a recession if some of those trends continue. We know that cuts to Medicaid also very clearly will disproportionately impact families of color. So on top of exacerbating our wealth and income inequalities, adding to the racial inequities that are already embedded in our economy. So, one of the things we will also talk about tonight is where we are right now in this moment, and perhaps at the end have a little brainstorming about what opportunities do we have to weigh in on this moment. I think folks are all here because in part you know that the federal government is right now in stage 23 maybe, or 23, 24 of a shutdown, the longest shutdown in the federal government in history. The policy deadlock is over the provision of that big, beautiful bill that is slated to cut the ACA healthcare subsidies that had been increased and extended since the beginning of the COVID pandemic. Folks estimate that if that provision of the bill passed this summer is to go into effect, 4 million Americans could lose their health insurance, and for 20 million Americans, their health insurance premiums could more than double. So it's a big deal that the deadline right now is basically Democrats saying, get rid of this threat to cut the subsidies in order to come to a new budget bill. And the other new development related to this is that, as folks may have heard, the USDA, the federal agency that administers SNAP benefits, as part of the Republicans trying to leverage an end to the shutdown without agreeing to restore the health insurance premiums, has begun to tell states that starting in November, they will not issue the federal funding that goes to food assistance. So that is a crisis, a looming crisis, with a very short timeline. But again, it's not something that has happened yet. And we do have the ability to still weigh in on trying to make sure that doesn't happen. Okay, and I'm gonna hold on this because I think we might want to talk about it later and turn it back over to Tony next, and then you. So.
All right. Thank you. Thank you, Jennifer. Next, we had a testimonial, but our person has not made it here yet. She's en route from Minnesota, but she will be. I'm anxiously anticipating her arrival. So could you kind of text her and see where she's at? And but we will continue on, and we want to bring up Sherer. Did I say it right? Okay. And she is the executive director of the Common Good of Iowa, and previously worked at the Child and Family Policy Center for 10 years. And she has an interest in using data, research, and stories to make meaningful change for Iowa families and their communities. And highlight the many interests and values that they share in common. Her prior experience includes neighborhood organizing, local government reporting for community newspapers, and research on social and tax-based disparities in the U.S. and metropolitan areas. She has a bachelor's degree from Luther College. My son went to work there, so I don't feel for you, but that's okay. She has a master's degree in urban and regional planning from the University of Minnesota's Humphrey School of Public Affairs. She lives in Des Moines. So please receive her real well as she comes into this. So while she's hooking up her laptop, I want to keep in mind, prepare your questions, because after we finish with the presentations, we will have a Q&A session, and then there you can ask the questions that you all the questions that you have, and all the questions that are kind of developing as we go through the presentation.
Thank you, Pastor. Well, I'm really happy to be here. Although, I know one of the members of the audience talked a little bit about the fear that comes from a lot of these changes. And I'm going to walk through a few more details of what we can expect to see happening, particularly around Medicaid and SNAP, but I do want to quickly at least offer some places to go for some details on Medicare. But it's all pretty different. There's a lot of pretty worrisome trends coming. So I feel like these slides are probably not going to do very much to alleviate fear. But I do think the idea that knowledge is in some ways the best antidote. Generally did know the fact that, some of these have not been enacted yet. And so at the end, we can kind of talk a little bit about where there might be some room for advocacy on some of these issues. And I'm going to start with some data because it's fun. I guess I would just like to ground this conversation a little bit around the importance of public programs to folks in this community. And I will say that statewide, about 740,000 folks depend on Medicaid or SNAP to put on the table to help with healthcare costs. And there's actually around almost 25,000 people right here in Johnson County. And the majority of those folks get Medicaid only. And then there's about a third actually are receiving both Medicaid and SNAP. And just a very small share of folks qualify for SNAP but don't qualify for Medicaid. And in a very holy system of healthcare and food security, these two programs are probably the most widely available help that we offer to folks who are struggling to get by in an economy that does not provide as many good jobs as we need. And so when we're talking about who's covered by Medicaid and SNAP, and with SNAP, we're talking first about low-income children. If I had to pick one description of Medicaid, it's health insurance for kids. For the largest group of kids who are covered, most households who receive SNAP also have children in them. They're an incredible source of food security and health insurance for kids. They are also one of the few ways that we do help low-wage workers fill that gap between what it takes to meet a basic needs budget and wages that are insufficient at the jobs that they work. I think particularly Medicaid, Jen mentioned the Affordable Care Act, which was passed in 2010. One of the really most important, there were a lot of important things it did, but I would argue one of the most important things it did was it expanded Medicaid to a group of folks who had previously been ineligible, and that is low-wage adults who were not able to get Medicaid coverage because they were a caregiver now. And so that is, we often shorthand that coverage group as Medicaid expansion. So you may hear people talk about it as Medicaid expansion. The state of Iowa calls it the Iowa Health and Wellness Plan. It really is its name, but they brand it that way. And at this point, it's become an incredibly important source of health insurance for folks who can't get it in their jobs. Medicaid and SNAP are also incredibly important for unpaid caregivers, for people with disabilities, and Medicaid in particular is really important for seniors in nursing homes. About half of nursing home residents are covered by Medicaid, and their care is covered by Medicaid. And I will say that's a point in time number. If you look over the span of people's time in nursing care, it's actually higher because many people can enter a nursing home and they have some resources. When those resources are depleted, then Medicaid steps in and covers that care for folks. So it is, it's actually bigger than Medicare. Medicaid, they were signed into law on the very same day in 1965 by President Johnson. And at the time, Medicare was the big news. It was an effort that actually President Truman had started to get coverage for seniors. And so that was the big news of the day. And then as sort of a secondary point, they consolidated programs for low-income families, mostly under Title 19 of the Social Security Act, and that was Medicaid. But today, Medicaid is actually larger in Iowa. There's more people covered by Medicaid than Medicare, and they're both really important. As we've alluded to, there are big changes ahead for folks enrolled in these programs. And I'm going to kind of work through this in a little bit of a timeline, but I do want to start with the thing that I think is the most concerning for folks right now, and it is the effects of the government shutdown. One of the things that did not get included in the Big Beautiful Bill was the extension of the Affordable Care Act enhanced premiums that make healthcare a lot more affordable for people who buy their insurance directly as opposed to getting it in their job. Congress chose not to include the extension of those. Well, now we're actually at a point where people are starting to get notices in the mail. They can go online, they can see the kinds of increases that they are facing. And so Democrats have pretty much made that their bottom line to agree to a budget deal, is that they need to extend those subsidies. Caught in the crossfires of that is SNAP. As Jen mentioned, the Trump administration has come out, the Trump administration has come out so they cannot pay the benefits. They are sitting on contingency dollars. They do actually have some ability to move some money, so I would submit that they are choosing not to push those dollars out to states, and they're, using the shutdown as an excuse to do that. But that's like a week from now, essentially, when folks who have, stretched their food budgets through the month and are waiting for that next allotment of SNAP to come, may not have dollars on their EBT card when they expect to. Here in Johnson County, each month, or actually, this was from these data were from probably July of this year. It's about $1.7 million that comes into Johnson County each month to nearly 4,600 households. And so not only is it an incredible lifeline for individuals, right, who really depend on it to feed their kids, to feed themselves, but it really is there's an economic impact, right, to grocery stores and kind of economic spin out from those dollars. But I also want to note that, the average SNAP allotment per participant is $173 a month. So that is very important dollars. It's not a food budget for a family, right? SNAP fills a gap, it does not fully, for most families, it does not fully accomplish their food bill. It ends up being about $1.91 per meal. So again, I think just to really reiterate what Jen was saying is that we do some things to fill that gap between what people earn and what it takes to make ends meet. SNAP, as important as it is, fills the gap, not the full way. But this is like happening right now, and I would say our organization's position is that SNAP benefits have to be paid. There is money to pay them, and that we really need Congress to put it, to put pressure on the administration. We need governors to put pressure on the administration to release those dollars that are available. If the shutdown goes on, the ability to move that money will go away. But for this month, there is a way to cover those dollars. I know food banks and food banks all around the state are meeting right now to try to figure out how they're going to help families fill the gap if this money does not come in next week. But better yet would be to actually move that money, and so people have money on their EBT cards. So now I'm gonna step back and talk more broadly about changes that are coming as a result of the one big bill. And I'm gonna again sort of go through them in sort of calendar order. And so I want to start by talking about some changes to SNAP that also go into effect just on November 1st, just this month. SNAP has already had fairly stringent rules around the ability of working age adults to get SNAP benefits without being able to prove that they're working volunteering or training. The big bill adds that reporting requirement to some groups of folks that used to be exempt. So people that did not have to show that they were working will now have to show that they're working in order to receive SNAP. And the changes come in the groups that are here, and first is for older adults ages 50 to 64. It used to be that starting at age 50, you did not have to prove work hours. Now that age has gotten boosted up through 64. So basically, until you're 65, you will have to show that 20 hours of work activity. And I love that is an age where some of those adults are starting to be caregivers. They're caregivers for grandkids, they're caregivers for a partner, they're caregivers for older, maybe older parents. So that's a period of time where there are people that just have pushes and pulls, and it can be harder to be in the job market, which is why those folks used to be exempt. Another group that is now will no longer be exempt is parents with children who are age 14 and older. All parents of kids under 18 used to be exempt. Now they've stopped. You lose your exemption once your kids are teens. So once your kids are teens, you have to show work hours. Veterans used to be exempt from this work reporting requirement. They are no longer exempt. People who are homeless used to be exempt from this requirement. They are no longer exempt. And people who are aged out of foster care used to be exempt until age 26. They are no longer exempt. And these are really pretty heartless changes in my view. And our group is we're nonprofit and nonpartisan, and that means we don't engage in electoral politics. We certainly do have a point of view, and I think my point of view will become obvious as we're talking. But these are changes that are going to make it a lot harder for some people to get SNAP. And then soon, we haven't seen a date yet, and part of the date is a little bit up in the air because of the shutdown. But soon a new set of restrictions will take place. Groups of lawfully present immigrants who used to be eligible for SNAP will no longer be eligible for SNAP. That includes refugees, people who've been granted asylum, and people who are trafficking victims. Estimates are about 4,000 people in the state will lose access to SNAP because their exemption is no longer valid. And again, in a state, I think there's probably people here in the room who remember Governor Ray, who, literally opened the doors to our state to refugees from Cambodia. And so this feels like a particular application of Iowa's history of welcoming immigrants and trying to ease their adaptation to life here. And then coming the end of the year are those, unless Congress acts, the end of those ACA subsidies that we've talked about. And again, this is for folks who are buying insurance for themselves through the marketplace, because they don't have access to it through the job. So there's around 118,000 Iowans who face higher costs because of the end of these enhanced subsidies. So for example, a 45-year-old making about $32,000 a year, their premium will go up about $1,200 a year. But now a 60-year-old couple making $82,000 a year, their premium will go up over $18,000 a year. Now, an $82,000 income is a comfortable income, but not enough to be able to absorb almost an additional $20,000 in health costs. And so we know what happens when people are faced with big increases in their health insurance. The people who really know they need that insurance, right? They know they have health concerns, they really need that coverage, they'll figure out ways to keep it. People who are healthier, some of them are gonna choose to just roll the dice and say, this is too expensive, I'm willing to go uninsured. And so it creates this sort of kind of death spiral, they actually call it adverse selection, right? So the sickest people stay in the pool, the insurance pool, and then that drives premiums higher. And then next year, premium, the stated premiums will be higher, more people will drop it, because the healthier people will drop out, sicker people will stay, and it will become increasingly unaffordable. So part of the value of the ACA and part of the value of these premiums is they make insurance more affordable. It draws healthy people in who would otherwise be uninsured, and it actually keeps everybody's health insurance costs down. So part of what we're seeing is not only that people are losing the subsidies for their premiums, but the premiums themselves are rising, because health insurance companies are actually, they're pricing that in. They're pricing in the fact that they expect that the healthier people will drop out and sicker people will stay. Yeah, I'm not a ray of sunshine here. Sorry, every slide feels just a little more bleak. A year from now, we will see the same changes to Medicaid that we're gonna see any day, related to SNAP, related to lawfully present immigrants, those same groups of folks, refugees, people granted asylum, trafficking victims, lose access to Medicaid. And then I know this came up early in the conversation, I do want to spend even a little more time talking about the work reporting requirements. Iowa expects to require people to report work hours, adults, starting up in next December. So we have a little bit of time to try to influence how this rolls out. But essentially, the people who will be subject to work reporting requirements are the people who gained access to Medicaid as part of the ACA. It's that Medicaid expansion group, people covered by the Iowa Health and Wellness Plan. So not everyone on Medicaid is going to have to be subject to this, but about 180,000 Iowans, again, largely low-wage adults and caregivers will be subject to these requirements, including about 7,000 people in Johnson County. So what are they? Well, let me tell you. So in order to meet the requirements, you will have to report either some combination of these, so at least 80 hours of work per month, so approximately half time. Or you'll have to prove that you're in school at least half time. Or that you're engaged in some sort of community service or work program, at least 80 hours a week, or some combination of these. So kind of 80 hours is the magic number, or half time in school. You notice there's an asterisk after the work hours. And this little asterisk is complicated, but actually it helps a little bit. So it's, you either have to work 80 hours you have to report 8 hours of work a month. Or you have to earn an income that equals at least 80 hours per month multiplied by the minimum wage. Okay, sounds complicated, but I'm gonna walk through it. So if you work at $7.25 an hour in Iowa, that's the minimum wage, times 80 hours, that's $580 a month. So that basically, if they can see that you make $580 a month, that's good enough, right? So one, that should make reporting easier, and that's why they're doing this. It should make reporting easier. They just look at income as opposed to actually having to count up hours on a time sheet. But what that means, and especially in a community like Iowa City where wages by Iowa standards are on the higher side, it actually means that for a lot of low wage workers, they should be able to meet that requirement at less than 80 hours a week. So if you take $580 divided by $12 an hour, people actually will only have to report about 48 or 49 hours a week, a month. So it's super complicated, but that's actually a little escape hatch that should, for a few people, make things a little bit easier. And yet, these are the exemptions. If you fall into that Medicaid expansion group, covered by what they call IHOP, you can be exempt from the work reporting requirements. If you are the parent or caregiver of a child under 14 or someone with a disability. You can be exempt if you're pregnant, if you are a foster youth or a former foster youth under age 26, if you are medically frail, and that is a term of art, like you have to meet certain, like that's a federal term of art, they can define what that is, or if you have other special medical needs, if you are incarcerated or released from incarceration within the last 90 days, or if you're a member of a tribe. I mean, those are some exceptions, right? But here's the thing, all of this has to be documented and reported to the state. In the case of work hours, we haven't seen for sure, but it sounds like the state is gonna want to see this monthly, every month. Now, not some of the medical stuff, you would not have to report every month, but if you're talking about work hours or community engagement hours or school hours, you are gonna have to upload like timesheets to the state every month. They are talking about developing an app that you can put on your phone. Here's the thing, I have young adult workers in my house, my kids. One works at ID, one works at a restaurant. Well, they're used to dealing with HR stuff through an app, right? ID totally gets it. You get your hours on your app, you get your pay stubs on the app. So there's a group of folks for whom that might be okay. You know, folks who are kind of tech savvy, who have reliable minutes on their phone, and who are willing to download an app and get a username and a password. But we just know there are many people in our community, and that is going to be an incredible challenge. We know from other states that have implemented this, most notably Georgia and Arkansas, that many people who are eligible fall through the cracks because the reporting is so onerous. That's kind of a feature, not a bug, right? I mean, the whole point of this is to save money, and the way they're doing it is by putting up administrative burdens that people will not be able to face. And so, I think there's a lot of conversations that advocates are trying to have right now with the Department of Health and Human Services about the ways to make this as seamless as possible for families. And on the margins, that can make a difference, but by definition, these are just very problematic. There's no way to fix them in a way where people aren't going to lose coverage because of them. Oh yeah, does it sound good? Yes. And again, that's probably the point. Got ahead of myself. And I guess I'm gonna loop back again and drill down a little bit from where Jen was talking earlier. Just to be really clear about this. Congress voted to ramp up the paperwork so that fewer people qualify, so that they save money, so they can pay for tax cuts. And I will give you at least one kind of way to measure that direct transfer. Jen showed some great data earlier. The savings that they anticipate from all the health and nutrition cuts over the next decade is about $1.2 trillion. And even in federal dollars, that's like a pretty big chunk. The cost in the big bill of the tax cuts just for the richest people, just for folks earning more than $550,000 a year, is $1.4 trillion. It's almost a one-for-one transfer of resources from health and for health and food security towards tax cuts. And I just want to kind of show you a little bit of what that means in reality. So this chart shows the average tax cut by income group, and that's for people in Iowa for the upcoming tax year. So you can see, because of all the amazing tax cuts, come over here and point to this bar, which is folks in the top 1% of incomes. So in Iowa, that's people making $678,000 a year or more. They're gonna get a tax cut of $76,000 a year. I mean, so what does someone with that kind of income do with a tax cut of $76,000 a year? I mean, they already need the basic needs. They can't buy more t-shirts really, probably, maybe a few. So what do? They buy their kid a new truck to drive to the private school that we're paying for with vouchers. I mean, do they remodel the kitchen in their Florida condo? Maybe one year they do that, but they're probably just sticking it in their investment accounts. I mean, they're just putting it into the stock market, they're buying AI stocks that enrich, shareholders in California. Over here, if you look at the bottom, 40% of earners, right? So people, sorry, I'm very bad about holding the mic close enough, so you do wave if you cannot hear me. So people making under like $57,000 a year, they're getting close to nothing, or maybe as much as $700. But those are the very same people who are losing Medicaid, who are losing their ACA subsidies, who are losing SNAP. Those folks, folks in the lower 40% come out worse on balance to offset big tax cuts. And again, to be clear, like middle income people, they do get tax cuts, but there are pennies compared to what we are giving to the richest folks. So what can we do? And I'm happy, I hope we can have more conversations about this after I'm done presenting, but first I just have some thoughts for folks who either are receiving SNAP or Medicaid, or who have loved ones or family members who do. And with the exception of the immediate concern around the shutdown dollars for SNAP, I think you can mostly take a breath. Some things are going into effect immediately. A lot of it plays out over time. So we have some time, one, for people to get ready, and two, to try to bend the curve on some of these policies and mitigate them. Very concretely, if you're receiving bump benefits, if you have moved, if you have a new phone, make sure that HHS can contact you. If your benefits are gonna change, if they need more information from you, they're gonna send you a letter, probably. So if you are not living in the place that the letter gets sent, you may not know. So make sure the HHS can find you. And you don't have to do much now, but it might be worth thinking about some of those exemptions. Do I qualify? How would I prove it? If I'm having conversations with my health provider, do I have a diagnosis for some of these concerns that we might be able to use for exemptions? We don't have guidance from HHS to know exactly what those are going to be, but it's worth probably just thinking about it. It might be worth a conversation with the health provider. And then, and then tell families, your family and friends, if there are other folks who are receiving benefits, so that they know to be on the lookout for the same information. And then I think there's a broader conversation for community organizations, community leaders, nonprofits, religious communities. I think to be really talking to ourselves, well, who is that one first? Okay. People are clearly going to need help proving work hours and exemptions, both for Medicaid and for SNAP. You know, how are we as a community providing resources to help so that people know where they can go? You know, and I think as much as we can resource up existing community organizations that are trusted parts of communities, that's all the better. I mean, you know, a place to go talk to a state employee is fine. Better yet, if you have a relationship with like a trusted community organization where you know someone there who knows your situation, you know, can we resource those kinds of groups to do this work? And then how do we fill the gaps for people who lose food and health assistance? Like I say, I know right now, probably literally as we speak, there's probably food pantries and food banks trying to figure out what they're gonna do next week if SNAP benefits don't come through. But there's a longer term conversation to be had, I think particularly around healthcare. What are the resources for folks who lose health insurance? And then finally, kind of for everybody, I think there is a place and a need for some real advocacy. Medicaid and SNAP are both joint state and federal programs. In both cases, that means that like the federal government sets those broad parameters and provides some or a lot of the money, but they're administered at the state level. So essentially what the big bill did is it forced a lot of the really unpleasant decisions down to the state, allowing federal officials to kind of keep their hands a little bit clean, right? We're not cutting, we're just giving more power to the state. So for now, at least, a lot of the short-term decisions rest in Des Moines. And I think there's larger advocacy opportunities to change some of the federal rules. But right now, HHS is making decisions. In January, the legislature will be making decisions about whether they're gonna pony up more money for SNAP that they're gonna need to do. So they need information, can also use a little bit of persuasion. And then, you know, by pushing responsibility from the federal government to the state government, what they're essentially doing is pushing costs from the federal government to the state government over time. And they make it's super complicated, like I could explain it, but I don't want to explain it. But it's all because they're trying to make this like hard to track as possible. But essentially, more costs are going to fall on state government. Well, the biggest piece of our state budget is K-12 education, higher education, and then Medicaid, and then everything else. So to the extent that Medicaid and SNAP become a bigger piece of the state budget, it's going to squeeze other parts of the budget. I think we especially do worry about schools because they are a large part of the budget. So advocacy such that we don't, you know, protect SNAP by making big cuts to K-12. If you would like updates around sort of the advocacy parts of this and more detail around what is happening at the state capitol and potentially back again in DC, we do occasional email newsletters. There's a QR you can use your phone and just scan directly to a place to sign up. Or if you just go to our website, there's a teal bar right across the top that says subscribe. And we absolutely welcome you to pop in your email and subscribe to our newsletters. Okay, that's all I got.
Thank you.
Okay, well, thank you so much, Ann. So right now, our mystery guest is here to bring her testimony here and to give us a real life, example of how these cuts and the cuts in our own benefits and things that have taken a negative turn, and without me trying to stumble through it, I want to bring up Loretta's.
Praise the Lord. How's everybody doing? Sorry I'm late. I'm glad I kind of got here when you were speaking. I missed most of it, but I was just experiencing some of the things you were talking about. I was down at Mayo Clinic And I was just experiencing some of the very cuts that we're speaking of just on today. And so I took early retirement several years ago because I became disabled. And at that particular point, I was eligible and did apply for both Medicaid and Medicare, which I had a dual eligibility. And it was pretty fluid at that time, you know, where you could receive your services, minimal co-pays or zero co-pays, that type of thing, you know, and everything that's associated with it. But as of this past year, it's been a nightmare. It's been just really totally unbelievable because this past year, my Medicaid benefits were cut. And as a person that's disabled, I have several issues with brain issues. I've had 4 or 5 brain surgeries. Last year, I had an aneurysm. I've had a skull reconstruction. I've had double hip replacements. I have all types of issues regarding my health. So I do need my health care benefits to sustain my life. But they cut my Medicaid. And because of that, I also have home health services, which is one of the benefits of, being on the state program, which is the Medicaid program. Of course, you also have Medicare, as I'm just explaining all this. Medicare program is a federal program, like I said, federal government is now handing everything down to the state. So with the cut and my services, I lost my home health benefits. So I usually have someone to come out and help me with home health organization, also taking errands to get my groceries, anything I have cataracts, so I've had cataract surgeries this past year, so everything's happening to me, but I lost a lot of services, so I don't have the help there. First of all, they decided, because I've been getting help for so long, along with other people on these programs, that they would still come out once a week to help me just because I needed the help. But as of May of this year, none of my Medicaid has not paid any of my workers. So now I lost all of my health care services, so no one's been paid. And what they did, they cut my Medicaid benefits. I had to advocate for getting those back appealed, reapply, which now used to be programs where now you have to apply every so many months. You have to keep filling out those paperwork, and you better not forget, as a person who has brain injury. And I've been on waiver programs since, now I've probably been on brain injury waiver program for like over 10 years. And now they put you on the elderly waivers, different programs, but the waiting lists are so long. So in the meantime, you're not getting those services. So with the services I was getting, and with the cuts, I don't have my home health care benefits, so I don't have the extra services. And so, and then also with that cut, I started receiving bills from my hospital bills where at one time I had minimal co-pays or no co-pays. Now I'm getting the bills, that I need to possibly pay myself after working at the church for Pastor told me to get a job or something. I don't know what's happening, but everything is now kind of falling into the lap of the person who's the recipient of the Medicare and Medicaid benefits. So that's some of my concerns and my issues. Also, with appealing and reapplying and getting reinstated, they reinstated my benefits. But however, they approved the Medicaid, but gave no notices of decision. So that means that although they have Medicaid benefits, they are still not paying any of them for my services. And the same with Medicare. Medicare cut, I got a lot of questions with Medicare, so they approved me to have certain injections that I need for my the pains that I've experienced with my body, but they don't approve the medicines that go inside of it, what do you call it, injecting with it. They don't pay for the medicines. So they're considering shots like cortisone, any steroids, any painkillers that look like the last 3 to 4 months or 6 months. They're unnecessary anymore. So they cut those out. But what they will approve is morphine, oxycodone, all of these narcotics that are addictive and, what I consider unnecessary. And then, a lot of people, as far as the doctors are concerned, they're getting rather frustrated because they have to they have to send out extra paperwork for all of the patients. Like today, my doctor had to appeal. I was supposed to get a particular injection today. I wasn't able to get it because they have to appeal now, right? Send to the government to get an appeal. You're waiting 2 or 3 months for the appointment. Then when you get to the appointment, you fill out the paperwork for the appeal to get the injection within whatever time frame that, they designate. So those are some of the things I have experienced besides having to get the co-pays for my medicine, which a lot of those things not covered by Medicaid. I have had to turn down medications because I can't afford all that stuff. So it can only, of course, it wants you to self-medicate, but you have to come up with your own, basically home remedies or, and then the main medicines that you do need, like ibuprofen, they cut those out, had to appeal to get that back, and then they send me a generic form that is totally powerless, that I was in so much pain for a period of like 2 to 3 weeks. And also with my aneurysm, I had doctors here to refuse to give me my medications, and I had to have my family advocate to get the medications I need because I had a lot of blockage in the back of my brain, which the medications were designed to resolve. But my doctor decided I did not need that. He would not give it to me, so I had to go through the long process of, having my kids yell at them, and finally get the medications in a generic form. So those are some of the things that I have experienced. I get transportation, med transport to my medical appointments. As I said before, very fluid. But I just missed about 3 appointments in the last few months because my med transport was cut. And then when you call to ask and inquire about these programs, they have new computer systems that no one understands because they have new programs, and it's like the robot comes on first, and then they say, I think I'll get one of my colleagues after you push it. It can override every 0 you push now. You keep saying agent. And when they finally said, let me get my colleague, the people that answer the phones, if they do finally answer, do not understand the new programs. And so they're giving scripted responses. They're reading a paper, and if you ask them a question they can't answer, they just continue to read, and say, oh, let me connect you. Then they connect you to a number that is the person that has nothing to do with what you asked about, or you're on the phone, like even I had advocates, my insurance agents to come and advocate for me. Last week, I believe, we spent almost 2 hours on the phone every day trying to get, I finally got transportation today to Mayo Clinic, which I was very grateful for, less than paying for other people, because I have been missing my appointments because I don't have the transportation, I don't have a home health care. So those are some of the things that has happened to me just within, I would say, between the period of May of 2025 up until now. So those are some of my issues, and as far as advocacy is concerned, I'm totally frustrated. Because what happens is the advocates are advocating to the advocates, we're preaching to the choir, we're talking to each other, we're all in agreement, but we need to, as far as the powers that be, it has no effect upon them because, the rich get richer, or they're not really caring about what happens to you as a person that worked for many years. And most people think that if you work all your life and they're taking your social security out and taking out all of these, different, payments per month, you think, okay, when I get old, then I'm sure that this is gonna kick in. Well, that's not true. And I'm glad I took early retirement, because if I hadn't taken early retirement, I probably wouldn't be getting any benefits at all right now. So that's my story. I'm sticking to it. If anybody has any questions?
Thank you for sharing.
The struggle is real. Struggle is real. And so now, and thank you, Evangelist Tessa, please give it. She came out, she came all the way, she was at a doctor's appointment at Mayo Clinic. And got the transport here, and the transport was late, and so that's why she did this time she was here, so she made it. And so I'm so glad that she was able to make it. So the next part of our program is our Q&A session. Oh, okay, yes, sir.
I'm ready to ask my question.
Okay, we get, okay. So, Q&A session, so I'm gonna invite Jen and Ann to come on up here, or I'll give you my, how about I just give you my, either way you wanna do it, I'll give you my, and then you can ask questions and they'll tag me on the answers. Do we have the second mic? Is the second mic ready? Oh, you got it already. All right. That's good deal. All right. So you want to come up here? You want to sit?
I don't appreciate your microphone, but somebody told me you better start. So. The question was, because some people will be able to give volunteer hours to help them meet the requirements, how can churches cope with that? Is there a limit to the number of people or hours, or there's some posted guidelines, and where do you find those?
It's a great question. I'm not sure we totally, at least as it relates to the Medicaid work reporting requirements, I'm not sure we totally know the answer to that yet. But, when we think about things that communities and community organizations can be doing, I think that's an obvious place. I mean, essentially, the federal government's pushing responsibilities to the state. The state is gonna have a hard time fulfilling the same level of support, which means this is gonna fall. It's gonna fall on communities. And so thinking about ways that communities can offer opportunities is right. I don't think I can tell you right now exactly what qualifies as that volunteer opportunity, but it seems like an obvious place where churches can help.
I'm assuming you'll need a 501c, so certain other things, and so I guess if you get to a point where you're putting together a group to begin to investigate those things, if you let me know, I'd be happy to be a part of that group to see what we can come up with.
Yeah, I love that. And I'm gonna jump ahead. I know I did not respond to Medicare, and I know we have a couple Medicare questions. And the short answer is, Medicare is super complicated, and the best that you can do is connect with people who specialize in Medicare counseling. I know the Iowa City Senior Center has a group there, they're called Sherer. Yep. No, it's not, but they are it's just the details of the plans are so specific and it's so tied to income that anybody, without seeing details over time, we were at a comparable session on Monday night, and folks from Lynn County, I was here, and Lynn County folks were even like, we don't dare give advice on this, we're gonna send you to the SHIP people, and so I'm sorry, it sounds like you're gonna say that they have not been helpful, and I'm super sorry to hear that.
Okay, so I apologize ahead of time. Actually, I went to SHIP, it was wonderful to have someplace to go. I waited for months to get the appointment.
That's the problem.
And when I went and I took all this time waiting, I got there and the gentleman was pushing Medicare Advantage. And he never answered the necessary questions for me to protect myself the best way that I could. And I was, of course, I would never disrespect someone much older than me, because he was. And I think he was given what he had. I don't think it was a setup or anything of that nature. But I was very brokenhearted and disappointed because SHIP does not have the answers that's really going to support people that need the information that will support you the best.
Yeah, and I unfortunately, we have this incredibly,
It's a big job.
piece meal healthcare system.
Yes.
And there's many parts to them and they're all really
Yes.
complicated. And so, if we, okay, I'm gonna start depressing, but I'm gonna try to turn it a little bit at the end. The kinds of cuts that are coming down really do have the ability, and particularly around Medicaid and SNAP, less around, the Medicare issues are more subtle, and I'll get to those too. But some of these changes could truly kind of break these programs. We're gonna have huge holes in our safety net, and that's the depressing part. The opportunity, if we get to that point, is that maybe that's the moment where we could actually build something that is more universal and works better. I mean, that is a very silver, it's a silver lining in what is a very gray cloud. But, as we look towards this, I mean, there's a lot of cuts, they are coming. We immediately, and it's really hard to get lawmakers to worry about things that haven't happened yet. And so the opportunity is we're already seeing this with SNAP. Wait, people aren't gonna have SNAP benefits this month. They're getting a new level of pressure. And I think as these cuts actually get closer, there is gonna be a new level of pressure when it feels real.
But I believe that if they were sincere about what they were saying, people like us, they're saying, oh, we need you to volunteer, we need you to work. They could in fact train us with all of the information necessary to support the body, and then everything paid for my brain will be more, yes? Then we wouldn't have to be in the shape we're in, but they just dump all of this stuff, and then it's like, oh, we're doing the best we can, well, in actuality, they are not, because they don't give us an opportunity to be a part of the solution. So I thank you guys for listening, and I appreciate you.
I want to follow up with one more Medicare point, which is that in the big beautiful bill, there was not much that directly impacts Medicare. So do not worry, there's no big Medicare cuts that are happening on a specific timeline. I think there are some indirect cuts though threats to Medicare and to Social Security that I think it's worth being aware of. I showed you the two pie charts, right? They're about the same size. It was the tax cuts and the service cuts. Okay, so they're making big cuts to health, mostly health and nutrition programs, but some other things too. And then they have tax cuts that are way more expensive than the cuts they're making to services. Okay, and so to make up the difference, they're just adding to the deficit. And so the long-term threats to Social Security and Medicare are that those tax cuts are so huge that over time they're going to put such pressure on the budget that the willingness to look at those that cut in Medicare and Social Security are going to get big. And there's actually some very complicated federal rules that at some point if the deficit gets so big, they're going to be forced actually to make some of those cuts unless they intervene to stop them. So I think there are longer term concerns about Medicare and Social Security, and they are related to the bill, but just more subtle because they're going to play out as deficits grow and automatic spending comes again. Do you have anything on any of these, Jen? You think about it?
I think what I'm thinking about in relation to the discussion so far is the combination of creative and really brilliant, I would say, ideas that people are already generating out of a crisis. To think about what are the resources and the knowledge in our communities, in our faith communities, in our nonprofits locally, that people can start thinking about that go along with the advocacy that we're going to have to, and the organizing that we're all going to have to ramp up. So there's both the, as we know, we're pulling together the knowledge and the support and the, what are the food next month, next month? And how can we become navigators for each other if the public system that we know we should have isn't serving all its purpose. And be doing that in a very public way that demonstrates what we should have, and also putting the pressure on our congressional representatives, and as Ann said, we're also gonna have to do that with our state legislature and governor, as we do that. I hear lots of ideas that I can see starting to put pieces of that puzzle together locally. And so that's the thing that I was starting to think about, just in terms of the silver linings, of course, as Ed says, of a crisis, are how do we begin to envision what the world should look like on the other side of what we know is going to be already a tough time and possibly going to be a tougher time that we got to figure out how to get through.
And thank you guys for coming out, sharing what was really important. Thank you so much.
But from, what are the innovative ways we think about creating volunteer hours and creating volunteer hours that serve some of the purposes and the gaps that people are going to be. I didn't come into the night thinking about that in a concrete way, but I can see people starting to put that vision together, so.
So you outlined a lot of very intricate, detailed work requirements related to staff and Medicare. Is the state of Iowa gearing up for that? Are they hiring people? Are they training people? Do they have a system for maintaining all of this information?
They're not hiring people. They're not hiring people. They, even under our current system, they map the income maintenance folks for the Department of Health and Human Services, they maxed out overtime last year. They're not planning to make an ask to hire more people. They are planning to make an ask for technology because they truly believe that technology will save us. It is things like, and so here's the thing, it's not all bad actually, like we will probably support some of these. They have incredibly archaic computer systems, and we're referencing that. And the Medicaid system doesn't talk to the SNAP system doesn't talk to the TANF system, certainly doesn't talk to any other departments. And that makes the workers they have inefficient, it makes it more inefficient for folks who are applying for benefits. So like some of that, we super support doing that, right? Like that should all be happening anyway. You saw the intricacy of those requirements. And there's some things you can probably just be exempted from in the last one time. Or is this, how do you prove, what is a good volunteer hour? Does it count? Who will sign off on it? Do I have a paper form? Do I have to take a picture of it? If I can't upload it to my phone, do I have to put it in an envelope? And they still do a lot of paper applications in the state. So to be clear, technology can help, but it's gonna take people. But again, it is that community piece because I think a lot of we work with a group in Des Moines that serves refugees and immigrants. And a lot of folks who actually have been eligible for Medicaid staff that are not going to lose benefits. They came here, they're refugees. But like when they get paperwork, they need not only they need someone to interpret it, but they also need someone to kind of culturally interpret it. So when someone in that community needs help, they go to the person at Embark because they have a relationship with Embark. I'm sure there's comparable organizations here in Iowa City. There are all over the state. So part of our push is when you're going to empower, it's community led, but like how can the state resource some of these existing community organizations where there's already trust and kind of shared cultural experiences. And so I just think some of that is going to be really important.
Sherer. I don't remember whether it was Nebraska or Georgia where they tried some of these requirements before, and I think their report was that the cost of monitoring outweighed the savings of monitoring.
Absolutely correct. They spent, I don't know how many hundreds of $1 millions in a big contract with Deloitte So this is gonna be consultant, there's gonna be so much money going to consultants and all of this. Because you know, there are currently organizations that are marketing themselves to every single state to do these apps. I mean, the state isn't gonna build its own app, right? It's gonna contract it with some entity.
Yeah.
Yeah, no, the Georgia, they spent more on it, like, they spent hundreds of $1 millions on it, and at one point there were like 3,600 people involved. They didn't jump through the hoops.
Or they caught like maybe out of all the people who should have been eligible, they may have found 1%, and those people, had they filled out some paperwork differently, could have been eligible.
Right, oh, no, absolutely, absolutely. And so again, there's a lot we can do, we just know people are gonna fall, we just know people are gonna fall into it.
Give the microphone back to Sherer. If the preacher holds the mic too long, you have to sing. And I don't sing.
You know, it's worth mentioning, I think too, that there's a whole tier of individuals who don't qualify for Medicaid because they haven't been in the country 5 years.
Yeah, yes,
So,
that is.
the free medical clinic system is also overloaded. Children, like young children in a family, for instance, of immigrants, newly resettled people can access Medicaid, but the adults cannot. Aged out adults who have not been working here in the United States long enough to accrue any Social Security benefits cannot get Medicaid until they've been here 5 years.
5 years, yep.
So they're also on the free medical clinic system if they can get in.
Correct.
There's just all kinds of weird,
And that was
not
because
working going on.
that's a federal option, it's an option, the states, and that's because Iowa, in a different political moment, decided that they thought it was really important that immigrant kids could get insurance right away.
But
We
not the parents and grandparents.
No, but see, some of those were covered because they were refugees, and some could get coverage for other reasons. But actually, it's one of the messages from all of this is gonna be, especially on the Medicaid front, even if you lose your eligibility, it's really important that people know their kids still may be eligible.
Yeah.
So when we adopted Medicaid expansion, which made coverage available to a bunch of adults, our children's health insurance uninsured rate went down. Because parents said, oh, wait, there's insurance available? They heard about it for themselves, and then it turned out their kids were eligible. So what we're worried about is the opposite will happen. Parents will get the denial notice, they will assume their kids are not eligible, and in many cases, kids still will be eligible. There's different coverage requirements, there's different protections for kids. So actually, that's a really important message as this plays out. Just because you lose your coverage, your kids may not, but they very well will still be eligible.
And I don't have any kids, it's just something that I learned being around the county for a while, the common knowledge believes that all these people who are new to the states who aren't citizens, that they're getting all this money and getting all these benefits. Technically, that's not exactly the case. There are health and benefits that they can get, but, they're added deficits for a lot of things, especially healthcare.
And that option that we adopted for immigrant kids to waive the 5-year waiting period, we could adopt that for pregnant people. Iowa does not, and we absolutely should, because it would help fill in the gaps in the groups that are gonna lose coverage. So it's the opportunity that we're gonna look at in the longer term is to get Iowa to adopt that option for pregnant people.
Which is a good thing. But still, what do we do about the aged, the adult, what do we do about the adults, aged adults and, the parents who aren't covered at work and who aren't covered by Medicaid?
Yeah,
And I know you don't have that direct answer, it's just rhetorical.
No, it's true. Here's a story that is ridiculous, and it was a story I talked to someone from Lynn County Public Health on Monday in Cedar Rapids. So a couple of years ago, Iowa decided to be among the very last states to adopt an option to extend pregnancy Medicaid longer postpartum. Okay, so it used to be that if you got coverage because you're pregnant, you lost it 60 days after you give birth, and we know that a lot of issues related to postpartum to recovery go longer than 60 days. So the federal government made an option available for states to extend that postpartum coverage to 1 year. It's a very good policy. It's good. It's a pro-family, pro-kid, pro-baby policy. Iowa was slow to adopt it, and when they finally adopted it, they only adopted it by cutting the pregnancy eligibility level like almost in half. We had the nation's highest pregnancy eligibility coverage, 375% poverty for people who play the FPL game at home. And we cut it to 215% of poverty. Which means that yes, for the people who still are eligible, now they get that year of postpartum coverage, which is very good for them. But a whole bunch of people who had their pregnancy covered by Medicaid no longer get it at all. I will note that was the drop that made that policy financially budget neutral. So it's no surprise they ended up at 215 because that was the point in which the decreasing eligibility for pregnancy coverage offset the cost of the expanded postpartum coverage. Okay, so that happened, chatting with folks at Lynn County, and she noted the big drop in eligibility for that population. And, you know, there have been all these kind of then theories around, so what does somebody do who's pregnant? And they were uninsured, now they can't get eligible, now they're not eligible for Medicaid. And so one game was that you would apply for the ACA, right? And then you would get a denial because you're not, or you would apply for Medicaid. You would get a denial because you're not eligible, and then that would unlock the ability, a special enrollment period. So you could apply to get coverage under the Obamacare. Well, the problem is that if you're unemployed, you don't get any subsidy. So it doesn't really work because PPMs can't afford it. So then what do you do? Well, then what the other idea is you apply for Medicaid, you will get a short period of what they call presumptive eligibility. We're processing your paperwork, so we're gonna give it to you for 60 days or whatever while we sort it out. So then you know you're not eligible, but you play this game. This is what they're suggesting you do. And then you get some prenatal care while you've got coverage before they cut you off again. And then you go to free clinics, and then you use another random part of Medicaid coverage called emergency Medicaid to cover your labor and delivery in the hospital. Except for what's happening is you can only get presumptive eligibility for Medicaid one time a year. That's the rule. So if you get it, and you find out you're pregnant, you go apply, you get to prenatal visit or something, you lose coverage. Let's say you have an emergency, you end up in the emergency room or a high-risk pregnancy. You've shot your presumptive eligibility, you can't get it again, and you're not eligible. So now hospitals in Cedar Rapids are saying, we don't want to take Medicaid for those early times, because what happens if you actually have an emergency and you can't get coverage? This is how we're covering pregnant people in our state. We're making them play these weird games of, well, do I use my presumptive now, or do you use it then? How do I fill it in with free clinics and then another kind of Medicaid when I give birth, which of course which covers no pre or postpartum coverage at all. It literally only covers the time you're in the hospital giving birth. So I'm sorry, that's a little bit of a rant, but I think it speaks to the holes in our healthcare system and the ways that we force people to have to make these weird decisions about how they're going to get coverage for really important healthcare.
Yes, I have a concern, but before I speak my possibly last concern, I would suggest that we all pray to God and ask God to be in a situation that totally believe in God, that He is the person that is going to intervene and help us all. But as you were speaking about enrollments, eligibilities, reporting, all of these things, a lot of these things are really online, applications. And for senior citizens like myself, I'm still in talk text mode. And the 800 numbers are long waiting periods. I mean, you put your phone on, what do you call it, speakerphone, and wait for 2 hours for someone to answer. And then get cut off possibly or switch to a wrong number.
Yes,
So meanwhile, we don't know how to do all this online stuff, so what can we do about that?
mean, that is, I mean, I think we're cycling around the same, the same kinds of things. I mean, healthcare is by definition gonna be a complex system. No matter, even if we had universal healthcare all run by the government, we're still gonna have a very complex system. Ours is particularly complex. But it is, I think it does really speak to what are the supports. I mean, we're gonna, by definition, we're gonna have to engage with systems, and there's gonna have to be 800 numbers. There's no way we're gonna have a healthcare system that doesn't require some of that. But how are we supporting folks? How are we giving people multiple options? How are we giving you, there's a place you can go in person if you'd rather do that, or here's online, or here's a phone call. I mean, there should be many points of entry that help people access systems, and enough resources that you don't end up having to wait on calls, on hold for 2 hours, to wait, hopefully can help you.
So the data that you presented, you're confident in the resources when you pull that data. I heard the word cynical earlier tonight, and I am. So I've kind of learned not to trust data, all right, without resources and stuff like that. So are these presentations available to us? Yeah.
Yeah, we put our stuff online, and, I think we can already see, and actually I'd be curious to hear Jen's experience at EPI. Public data is getting harder, mostly it's getting harder to get. I've been, mostly less worried about it being accurate, but access has been a challenge. It's been a challenge at the state level for a little while. There was a bunch of really great youth health data that used to be available, but they asked kids about LGBTQ+ status, and so the state decided not to do that study anymore. But I actually am curious what your experience is of the federal level.
Yeah, and I should be very clear, I am not one of the economists at Economic Policy Institute. I'm a policy person and an organizer, but I can say with a lot of confidence that one of the reasons I went to work there is in one of the most trusted, reputable organizations with a track record of accuracy and reliability. I mean, our entire organizational brand is about being accurate. And even within the time I've been there, I've learned a lot about what that looks like. The layers of vetting, fact checking, and sometimes corrections if something's found to be error. So I stand up and show that data with a lot of confidence because I know what's behind it. What Ann is bringing up is that we are living in both a media and information ecosystem that is actively creating doubt in everybody's mind about how you trust what sources you're looking at. And then on top of it, we've got at the state and now the federal level, folks in charge of some of the agencies that we used to rely on for accurate public data. I mean, a lot of the data that our economists typically use came directly from the federal government, and those systems have been built up over generations and decades. Whether they're surveys or they're, federally supported across administrations of Republicans and Democrats to be neutral, trustworthy, reliable sources. This is, I think, at the federal level, maybe one of the first times in our history where people are beginning to get a little nervous. There is not, and our economists are so far saying this, there is no reason that we know of to be doubting the federal data we're getting so far. It's still being put out by very knowledgeable, reliable, experienced civil servants. There is already a concern about access. So as Ann said, a lot of those positions have been cut, or folks with, so there just isn't as much staffing in those agencies. And of course, because of the shutdown, very specifically right now, we're not, for example, getting the usual monthly jobs data that people rely on to forecast what's happening. So there are a lot of things like that to be concerned about, and down the road maybe more. But I think both our organization and the network of the organizations that, like the one Ann represents, we're there specifically to give people data they can trust. So hopefully and same thing, anything on our website, it's publicly available to share, use, do whatever you want with it. You don't have to ask permission. It's not copyrighted. So, yeah.
So I would like to emphasize that our long-term goal needs to be universal health care. I have traveled a lot internationally and been with friends in Sweden and France and Japan who had to go to the hospital, and in all cases, it was free. The hospitals didn't even have a mechanism to bill anyone.
And I'll just say, I've been thinking about that as a theme in so much of what folks in the room have said tonight, right? Again, going back to that, what's the vision of the world we know we need and that we have to be creating in the midst of the crisis? And, one of the themes that has been so clear, crystal clear in several people's personal examples of dealing with the system and the testimony that we heard is the unbelievable inefficiency that our systems are creating for individuals, for people who have to try to staff these systems, and the cost that we all then collectively bear because we're compounding, creating crises for people that didn't even happen in the first place. It's unbelievable inefficiency. So I think and I want to go back to something we heard in the testimony too about the reality of all of us sometimes feeling frustrated about where is our message going. We had a little bit of brainstorming about this in Cedar Rapids and before we did earlier in the week at the end. What I heard tonight in this room is very, very powerful messages and stories that, the next stage of organizing is, I think, people thinking about where we want to put those stories and which influenceable elected officials, even the ones who don't ever talk to us or respond, they are influenceable, right? They need to feel the pressure. Where do we want to take those public stories and in what kind of form and format? So, this is me speaking just as a local community member at this point, not my, EPIJ job. But, that's where I feel we got a lot of people in the room who have a lot of experience figuring out how to do that. And if those are next steps that people want to think about and explore and pull in some of the groups that we know are sharing the same concerns and thinking about what the public response is. I'm definitely up for that, conversation. So.
I just want to know, maybe you've already addressed it and I missed it. I'm saying, where do the victims go that need the paperwork and the computer work done that they can't do on their own? So is there a site somewhere where, because with all that you're talking about, and as much of it is, it's going to be hard for both sides to handle it. And I know the people that have to do it or help process it, most of them are going to be under construction. When you are speaking, I was saying, when is she going to retire? She's not going to give up the bike soon because it's a lot. But I'm just saying, that's kind of an ingest, but it's real, to the situation we're talking about. So I know people are going to need help. Even paperwork is bad. The computer is even worse. You can whatever, you can't fix it, you can't find it, you don't know how. You're already scrambling to begin with, and so I'm gonna cut it off because I think you got the gist, and maybe you can answer, maybe you can't.
That is correct. I remember the first time that states started playing around with these work requirements. And I remember hearing an interview with the New York Times reporter, right? The reporter for the New York Times, privileged, lives in New York, super smart, woman. And she's like, I remember this time when they got a form and it had to be notarized. And I'm like, really, Phil? Wasn't all the like resources in the world, we know that this stuff is hard, right? You bring it, you're not sure, I don't understand, what do I do? And so it's just, it's a barrier. And so I think there's that, I think our, we need resources, and I think it's a community conversation, and actually, I go around the state a little bit and have groups, and every time I've been in Iowa City, I always feel like this is a resource-rich community, not community resources. So I mean, in many ways, Iowa City is in a better position than many communities to have these conversations, because there's a broad sense of community agreement around, that we all do better when we all do better. And, I sort of feel like communities, I mean, it's both. Obviously, communities are gonna have to step up, but we can't then be like, oh, we don't need the state, we don't need the feds. No, we do, and we need those resources. So it's both.
On the subject of resources, we had a different experience with Sherer. It was, we had no knowledge of how to do the Medicare and all that stuff, and I had a very positive experience there. And I will say that the gentleman probably didn't answer all of our questions, but he steered us to people and organizations that could answer those questions. So.
That's wonderful. And we went to the senior center, and we did not have to wait, I can't even remember, we had to register to go, but it didn't take very long to get an appointment, which to attend a senior class. And it was, it was intense. There was all this information that they talked about Medicare Advantage, traditional Medicare, the drug plans and all that. And this particular gentleman was very neutral. He did not push, like selling you a plan or anything like that.
They're
So-
forbidden, they're not allowed to,
Well, yeah,
they're not ours.
right. They're not reimbursed, in any way, or they're just volunteers. And I was astounded at his level of knowledge. So I encourage you to maybe check it out in the senior center.
Can you give its name?
Well, I have to look, and this was a couple of years ago, so,
So we left with more questions than answers, but he also told us where to go to get answers to those new questions.
Well, that's what I'm saying, but now we're asking the question, because now we got a whole new situation. We're talking about monthly paperwork or whatever it is was said in the presentation. I'm, so I'm just saying, where are people gonna go to make this happen? They're not having to do it themselves, so somebody else is gonna get a system set up where that they can feed in there and it's not a problem for them. Or somebody, if you got to take care of it yourself, where are you gonna go to get the help? I mean,
Johnson County does have an aging specialist, and they have had at least 2 navigators to help people navigate social services operations. You
that
can,
was my question.
yeah, you can. The only problem is that they really need more people, because a lot of people are having trouble, with certain things. People for different reasons have difficulty. So, and you might have to take an appointment with them and wait. Those are the disadvantages.
Well,
But you can go to
they're talking about monthly, monthly things that have to be done every month for in the process. And I'm saying, that's a lot to do. It's one thing to have something put something in a system that's gonna continue.
You mean like the hours of there? You're talking about the hours, the work hours.
Everything, yeah, I'm just saying, how is that gonna happen? Does it happen at the employer's level? Does it happen at your level? If you have paperwork that's trying to fill out, where do you go if you need some help? That's all I'm.
Yeah. My understanding from talking to people at the state is under the current administration, they intend to make an app available to people or make forms available on their website. Now, and I I have no opinion on this, I am speaking from a 501c3 nonprofit, nonpartisan organization. I will say a different administration might make different choices around that. I have no opinion, I'm just saying, out of the current administration, they envision that they are gonna have a technological fix and that people will upload work hours to an app and that this will solve the problem. I think you accurately questioned that whether or not that is true. I share your question about it. But that means if we can't count on the state, then it is, where's the community foundation, where's the United Ways, where are churches, where are community organizations banding together? Schools. And I hate to be like, I don't know, we know how you figure it out.
Well, unfortunately, I think we're gonna have to wrap this up. And I knew it was gonna happen. It started getting good questions, good conversation. What happened, and now it's time to go. But, I really appreciate, first of all, let's give a round of applause for our speakers. Thank you all for taking some time out. And it really jarred my mind, you know, as a pastor, how can we, as a church, you know, insert us into the process to help make this process better. I hope, is this the justice group from Zion? This is something that maybe, you know, the back to Zion, you know, there's something that you can think about also. How can we insert ourselves? You know, what is it that we can do, as a ministry, as a church, to help? Because we're at the beginning now of something that is about to escalate a little bit further, you know, and we can see some things, and there's some things that maybe we can create actions from. So let's not let this conversation die at this, like most things die, and we have this big forum and this sharing of the minds, and all of a sudden we go back to our comfort places and problems still there. And people are still suffering, and nothing has been done. We will follow up again on this in one way, shape, or form. Once I collect some data from you all, and also collect from Zion and my own church, and see where we can go with this next. Again, Evangelist Tessa, thank you so much for your testimony. I think us being able to, and Sister Jamie, and who else has some very powerful testimony, that we can see that this is a little problem, and it's right here in our face, and we can't walk away from it. So, thank you, let's reconvene.
Thank you for having me.
Okay, all right. Have a great evening, and we'll see you. We can